Hello and welcome to the presentation, Plant Cleanliness and Facility Risk Mitigation from Closure Due to COVID-19. My name is Alex LeBeau. I am the owner of Exposure Assessment Consulting in Orlando, Florida. I offer toxicology, industrial hygiene, risk assessment, and public health consulting services. I have my doctorate in toxicology and risk assessment. I am a master of public health degree, and I am a certified industrial hygienist, a board certification offered by the American Board of Industrial Hygiene. During my career, I have performed toxicological evaluations of chemicals and biological agents. I have evaluated exposures in indoor environmental quality settings at healthcare and industrial facilities, as well as other types of facilities. I have provided expertise on consultation on different kinds of exposure claims, and I have authored safety assessments for antimicrobial pesticide registration dossiers and generally recognized as safe food ingredients following FDA scientific procedures. This presentation is offered in conjunction with the American Industrial Hygiene Association. AIHA is an association for scientists and professionals that's committed to preserving and ensuring occupational and environmental health and safety in the workplace and community. I am a member of AIHA. I am also the secretary of the AIHA Indoor Environmental Quality Committee. Today's objectives are to recognize that there are a variety of indoor work environments that need cleaning, whether it's your facility that you're used to or a facility that you are responsible for that you may not be used to. Understanding how administrative controls can contribute to a cleaner work environments, whether that's generally applicable or specifically for COVID-19 for what we're dealing with right now. Identify methods to maintain a clean work environment in a variety of types of environments. Understand administrative ways to facilitate employee workflows for exposure reduction. And last, we're going to learn some of the downstream impacts of hazard mitigation following closures because of either COVID-19 or potentially other closures that may require your facility to shut down for public health reasons. Some of you may be familiar with industrial hygiene, some of you may not. Typically, when we're industrial hygiene evaluate a specific kind of scenario, we look at this decision framework. We anticipate, recognize, evaluate, control, and confirm as this risk management framework. We anticipate a potential hazard, whether it be COVID-19 or some other kind of chemical in the workplace. We recognize that the hazard is present, meaning that we have employees who potentially have COVID-19 in the facility. We evaluate it. We evaluate exposures and determine the hazard is a risk. And based on what we know for COVID-19, it is a risk. We have identified that there are mortalities associated with exposure. So therefore, we need to next control risk from that hazard using a variety of methods, one of which we'll go over today, and confirm that that risk mitigation is effective. How are we going to confirm that? Monitoring cases to see if there are any additional cases in your facility, doing some verification procedures, which we'll go over today. Now today we're going to go over a variety of indoor work environments. And I'm presenting these to you because some of these facilities you may be familiar with, some of them you may not. Some of these examples may be directly related to your responsibilities. Some of them may be indirectly related to your responsibilities. And I say that potentially you have a facility where you've been working for a while and suddenly there's an acquisition and now they are more vertically integrated at the company, and you're being put responsible for this new facility, which you may not be as familiar with as you are with yours, and that has a different set of exposures, a different set of cleaning needs, a different set of people in it. So I want to give some examples of some of these workplaces so you can understand that there's not a one-size-fits-all model for performing cleaning or risk mitigation of facilities, that you need to tailor it for each individual scenario, exposure scenario that you're responsible for. So this first facility, it looks like a highly automated facility. There's a lot of operational machinery and supplies for those. In the blue circle on the right, there are some people that look to be 5 to 7 feet apart. There are some people on the left in the red circle that may be 3 to 4 feet apart. There is some social distancing going on there, but you can see this is a large facility, but it is also a relatively empty facility, at least this portion of it. So this facility may not require as much either cleaning or risk mitigation as other types of facilities may be, just due to the operations that go on. Here's a factory environment where it looks like a gentleman has just removed something from a furnace. He is working alone, and there are two gentlemen behind him that are, let's just say, 8 feet from him that are at individual workstations that they're standing at. There's distancing going on, but it shows the challenges of uh, products that I'm working at. I see the gentleman's hands on that pole. I see one individual has gloves on where the other does not. I see some boards that they're operating on. So this is just another potential environment where people could be have some exposure to something based on what they're working with. What about this environment? What this is not something you are used to at your facility. However, there's been an acquisition and you are now responsible for the safety or environmental cleanliness or exposure reduction in this facility based on the now vertically integrated company. So this is a manufacturing facility, and there's a lot of people here. There's a lot of equipment. There's a lot of people. They are very close. How do you deal with a scenario where this is what you're presented when you're not used to this scenario, when you're just mostly maybe used to a factory setting or something where there are not many people? We'll get a better example of this in a moment. How about this view of this facility where it gives another end manufacturing uh, plant where they are a lot of equipment, there's a lot of individuals, and they're very close together. How are you going to maintain cleanliness? How are you going to maintain potentially social distancing? How are you going to be productive yet uh, keeping COVID-19 in mind for making sure your employees are safe? If we look at the black boxes, what if we took out every other employee? Would that be enough to give social distancing and to give safety for those that are around? Or do we need to take out every other row, like with the white boxes, where we may have to eliminate potentially half the work environment to make sure that we're maintaining a level of safety, a level of cleanliness, a level of distancing, a little of administrative controls to make sure that people are safe when they're in the work environment? So far, we've seen some examples of manufacturing, automation, facility floors, but what about administrative? What if your facility has administrative offices, like many do, attached to them? This is an open office plan, which a lot of people have gone to recently over the past 10 years or so, which we're going to change from going back to integrated individual offices based on what we've experienced so far with COVID-19. But how do you manage your exposures here? How do you control? How do you clean? How do you maintain? Because this is not a factory or foundry floor. This is not a facility or end production line. This is just we'll just say administrative area. You're not going to be able to treat this area the same as you would your foundry, factory, or other area. Well, how about this area? We discussed, maybe you've had a facility that's now under your control, where you may have administrative offices, but maybe you also have a call center. Maybe you have customer service at your facility that you're dealing with. Maybe it's your operation is on one piece of property and everything goes on there, from administrative to customer service, shipping, end product manufacturing, etc. How do you manage exposures, or how do you maintain cleanliness here? You see on the right, there's some empty tables. Do you put individuals at every other table to make sure that they're not being exposed to each other, or you're managing that? How are you going to clean this equipment? Are you going to have a routine? How do you come through here when people sit there for 8 hours a day at these workstations and potentially can swap workstations if they feel like it? Those are things you have to consider if it's not a facility that you're either used to, or you can't apply one cleaning protocol or one protocol for exposure mitigation to all scenarios. The last example was a relatively new call center, relatively new customer service area that was clean and open and new equipment. What about this scenario? What if you have an older setting where people are on top of each other, they're facing each other, they're 3 feet or less from faces? How do you clean and maintain social distancing? How do you maintain the level of protection that's necessary for these employees when you're used to potentially dealing with other types of scenarios. So these are some of the things to keep in mind as we go through this presentation. The important thing to get across with the examples that were previously given is that the indoor work environment comes in all shapes, sizes, and designs. And because of that, there are different exposure scenarios that can potentially be encountered in each of those. So who are the types of people that are going to be exposed that we're going to have to take care of with cleanliness or other risk mitigation techniques? Well, employees mostly. Those are going to be either their factory or floor employees or end use or manufacturing employees or even office administrative management employees. What about contractors? What about maintenance personnel? What about people who are installing new equipment in your facility? How are you going to control their exposures or maintain their safety when they come to your facility? Or what about janitorial? If you are outsourcing your janitorial services, your cleaning services, which a lot of people are doing right now, and especially for their cleaning services and facilities, how are you going to maintain the safety? How are you going to understand what those employees are doing themselves within your facility where they could potentially be exposing themselves and not familiar with the surroundings or not understand your controls that you have put in place. So those are people that you need to keep in mind that you may need to control their risks when you're in their facility, whether it be cleaning or other administrative controls, and we'll get to that in a moment. So in a facility setting, what are administrative controls? They are controls or actions that can be taken by management to reduce potential indoor exposure. So some examples I give here are workplace cleaning. That's one thing that management can do to make sure that there is a reduction in exposure within the facility. However, as we pointed out with our examples earlier, not all workspaces will need the same type of cleaning. Some may require very specific, some may require targeted or high touch areas, and others may require a lower level, just depending on their use scenario. What about changing the activities of employees? And we'll get into this a little bit. How they interact with others and how they interact with the work environment will be important. Are there certain things that can be done in different ways that will reduce their potential to be exposed to each other, therefore mitigating the risk of contracting COVID-19? And what about controlling the source of exposure? And again, as we discussed, the source, both the cleaning, which is a potential source on surfaces, and individuals themselves, which CDC has recognized as a source of the virus. The first administrative control we can look at is cleaning and disinfecting. Infectious SARS-CoV-2, the virus responsible for causing the disease COVID-19, it may remain viable on surfaces that are deposited from infected individuals, whether those are respiratory droplets on surfaces or other secretions from mucous membranes. There is some information from CDC says that it's not thought to be a major contributory factor for infection, but there is no data that I have seen to show that this pathway, exposure via this pathway, does not occur. So it's important because there is potential for it to occur that you establish cleaning and disinfecting protocols. And this is something that has been done in healthcare for a number of years. There have been established protocols for cleaning certain areas at certain times with certain materials. And it's important to remember that we're not talking about a one-time cleaning here. Say you have an employee that presents as having COVID-19 and he was at the facility, or he or she was at the facility, and then you did a one-time workplace cleaning and think you're good to go. What needs to go forward from now is that for a facility, for a variety of facilities, whether it's manufacturing, again, whether it's office space, a call center, admin, customer service, whatever is from under your responsibility, is that there is a protocol established for cleaning and disinfecting. So it's going to start with performing a facility assessment. What areas are there? What particular cleaning is needed to be done? Or what are high touch areas within those facilities? Are there things that need to be cleaned more often? Say you have door handles. Those may be touched more often. Is it wise or viable to clean those multiple times during the day instead of just having a cleaning crew come in at night and do it? You know, you may need to have people during the day to take care of those high touch areas. And it's important to realize the difference between cleaning and disinfecting. Cleaning is removal of any surface deposits with a detergent like product, soap, or anything else. Disinfecting is actually using antimicrobials that are approved by EPA for disinfecting the surface, and those have to be used in accordance with how the product is designed. If you're doing cleaning and disinfecting, are you using internal people, or you have your own janitorial staff or maintenance staff, or are you outsourcing it? And what are the requirements of your outsourced material? What are they giving you? What are you looking at when to clean and disinfect, as we discussed? Schedule it for even high risk areas, not even high touch, but maybe some high risk areas as well. And what about reporting infected individuals at the facility? You know, if you come across someone and they are reporting as a positive in their workplace, maybe it hasn't been, maybe they were just there, that area needs to be go cleaned, or whatever they contacted may need to be go cleaned. So this is going to apply whether it's for your own internal maintenance or janitorial staff, or if you're outsourcing to a third-party vendor or company. You know, what products should be used in the facility? There is a list called the EPA List N that lists products that are considered effective against the SARS-CoV-2 virus, and they are included on that. For each one that goes through approval EPA, they specify how to apply it. You have to apply using approved methods, because those approved methods, the efficacy of those methods has been evaluated by EPA and shown that it can be efficacious on the surface for getting rid of any material for disinfecting. Unapproved yet still used, there are people who are using unapproved methods. You may have a vendor that says, we have all this done, we can do it, no problem, and you come in and they are spraying in a manner, whether they're using some kind of fogging machine, and the material is not intended to be fogged. That could create a secondary hazard within the workplace. So that's something to keep in mind. If you are having a vendor do it, you need some kind of oversight of that vendor to review those protocols, to review how they are cleaning, to make sure that they're doing a safe method, that they're not going to potentially expose your employees to anything during their cleaning process. And about training for cleaning and disinfecting. If you're internal, again, are you doing it per the label? Are you training your people and for how to do it? That's going to be both effective to to disinfect the virus on the surface, or are you doing it in the safest manner according to the label? If you have a cleaning protocol in place, what is the best method for establishing that it was effective? There are tests that are out there and available for a variety of outcomes, but you have to understand why you're doing tests. You want to make sure you're developing a testing hypothesis if you're going to do any kind of surface testing. What surface testing are you going to do? There are SARS-CoV-2 surface tests that have popped up all over the place and available. What do the tests mean? You need to understand what the actual test is and what it means before you actually take samples and analyze for it, or you're doing yourself a disservice. You have to understand what the analysis is going to tell you. If it is qualitative, semi-qualitative, quantitative, and say if you get detections back, what does that mean? Or is everyone at risk? Do you need to clean the whole area, or do you need to clean the whole facility? Whatever, you're using surrogate methods. There are things out there, there are ultraviolet tracers that you can apply on surfaces that you apply before you clean and disinfect. And afterwards, you observe and make sure that there are no fluorescent materials remaining on those surfaces to show that it was cleaned. ATP is another tracer that can be used testing before and after cleaning and disinfection to show that it was eliminated. Or another option is to have some third-party verification done and observe what is going on. take some observations and someone come in and say, yes, they are cleaning according to the protocol. The material remained on the surface for the dwell time or the contact time that was specified on the disinfectant. It was wiped appropriately. Everything was done according to the outline and the protocol. So we're documenting that this cleaning was effective per the protocol. So again, it goes to your level of understanding of the testing, understanding of why you're doing the testing, and the level of risk that you're comfortable with for verification or verifying that a surface was cleaned according to the protocol. One administrative control that we can explore is changing employee behavior. That may be difficult depending on the employees. Some of them are very maybe set in their ways. Some of them may have had training, so there may be retraining that needs to be done. But the way that people interact with their environment and themselves, each other, the other employees, is important to understand as a good control method. So what are some examples of that? The first is looking at alternating shift work. Perhaps it's performing only certain tasks during a shift to reduce potential for contact. Say if you have multiple operations that go on during shifts, and you decide that maybe people are too close, that first shift people are doing this one particular operation, and second shift they're doing the second portion of it. It may be a little more time consuming, but you have to weigh that against the potential safety of the individuals under your care at your facility, and weigh that also against the ability to be productive and get people working. You want to have a productive facility, and it may be difficult if people are working in close contact. What about dedicated assignments? You could assign people their area. You could say this is your individual zone or your individual workstation for a particular shift. What about assigning equipment? Say they have sets of tools that everyone shares. Instead of cleaning those tools between each use, maybe you need to get additional tools so everyone has their own set, so that is assigned to them, and that will be cleaned at the end of shift by either external people or internal janitorial staff, or if you are open to the responsibility of having those employees clean their own equipment and can do it effectively and can establish that, that may be something that they can do. What about operational flow? If you have a facility where people come in close contact in tight spaces, you may need to change how your operations are going. One example is a one-way hallway. In other operations, I presume that you have things set up in your facilities to be as streamlined as possible. However, you need to consider if there are process lines that cross over each other, you may need to do those operations one at a time to reduce potential exposure if those people are potentially going to cross paths, so to speak. What about another one is how people interact with their work environment. If you have a break room or a lunch room, how are people using that break room? If people go over there every hour or 2 hours for a coffee break, how are you going to handle that? Are coffee breaks now outside? Are the coffee machines outside? Who's going to be cleaning coffee machines? Who's going to be cleaning handles? How are you going to be handling restroom use for employees? Are they going to be staggered? Are they going to be allowed to be all in the restroom at the same time? How do you regulate that, or how do you monitor that? These are just things you have to consider when you're looking at potentially changing employee behavior to make sure that they are operating at the safest or highest level of safety that they can be at the facility. How do you deal with employees, as I mentioned before, doing potential work in shifts or different areas? Your social distancing. CDC recommends approximately 6 feet between people. If you are looking at your facilities and based on their layout or based on their structure, and again, whether it's a operational facility or foundry work or even an office space, is 6 feet feasible in all environments? If it's not feasible, what else or what other steps can you potentially take to reduce exposure, reduce potential contamination by those individuals in those spaces? We're going to get a little bit of that on the next slide as well. How about face coverings? Now, we can make a distinction between face coverings and personal protective equipment or respirators. Face coverings we can view as administrative controls, and what they are source controls. They are controlling the potential source of the virus, which is exhaled breath or exhalation from a potentially infected individual. That is protecting the environment. That is protecting other people. Respirators, or use of PPE, which is a respirator, an example is a respirator, protects that individual from that virus or from any other potential hazard. So face covering, like a mask, is a source control. A respirator is a piece of equipment that protects the individual. And it's important to make that distinction because they are serving as a source control and not a means of personal protection. Examples include surgical masks. There are cloth masks, and there's a multitude of variety of these, whether they're one layer or two layer, whether they're made of cotton or polypropylene, whether they're pleated or not. Some people will use bandanas, and others will use gaiters or these neck coverings. And if from an administrative standpoint, if you want consistency within your facility, it may be wise to recommend that or have everyone in the facility use one type of equipment, whether it be one type of face coverings that you identify as the most effective for what you need, or you issue them all respirators for use in the facility. It's important to make that distinction because, for example, there's a study that came out recently that said individuals wearing a neck gaiter will actually create more respiratory droplets, which is a way the disease is transmitted through the material that the neck gaiter is made of. So if they sneeze through a neck gaiter, it will create more aerosols or more particulates than they would normally just breathing exhaled air. So it's important to make a distinction, understanding of how you are administering use of face coverings and maybe making the higher level decision to have a consistent use of them, whether one particular mask or bump it up to using an actual respirator in your facility. That's something you need to keep in mind, but that's a way to reduce exposure. And again, whether it's COVID-19 we're discussing or other potential workplace hazards. And an example is an administrative control within your facility as silly as this may all somewhat sound, is you need to make sure that you are instructing or training your employees if you are going to use face coverings like masks, use them properly. I see a lot of individuals that will only cover their mouth and not their nose, which again, you can still create respiratory droplets from your nose, not having it in the correct position or even putting it down your chin. But when you put it down on your chin, you could be potentially contaminating it. You're touching it, you're moving it down. Anything that may have deposited anywhere else on your face, you may have grabbed it, or you may come in contact, the mask may come in contact with it, and it may move it up to your mouth while you're actually be making direct contact with it. So it's important, if you're going to use that as an admin control, that you instruct your employees and train them the proper way and remind them if anyone is doing anything that is not in compliance, just say, hey, there's a proper way to do it, and this is it. So one thing to keep in mind when you're looking at administrative aspects of keeping an environment clean and reducing exposures is to use some technology items to control in exposures in indoor air. There are some devices that are made available out there that are being sold as either cleaners of the air, or they are introducing some kind of chemical or something into the air to either clean it or eliminate a virus from it or spread a cleaner over a certain area to disinfect. One of those examples is fogging. And fogging is a general term, and it has very specific use conditions, especially if the material that the disinfectant's being fogged needs to be approved for that methodology. Other devices that are out there are something called ion or plasma air cleaners. They're devices that go in HVAC systems that are marketed as introducing material or some kind of charged particle into the air that will reduce any virus contaminant in the air. And that's something you need to be aware of because you don't know what you're introducing into the air. You need to understand, and there's a lot of material that may be included in the marketing, but you're going to want to have some kind of third-party safety assessment of that product to understand what is actually being introduced in the indoor air, because you don't want to um, mitigate one potential issue, which is SARS-CoV-2, again, the virus, and replace it with another issue, which is an exposure to a chemical. So all the administrative controls you have set up are making sure that you're protecting the individuals from the virus, but maybe you didn't set up your controls to protect them from whatever chemical you're introducing into the air. Another is a system that's called vaporized hydrogen peroxide, or VHP. It uses a hydrogen peroxide type material. It's vaporized into the air, but it's important to know that it has specific use conditions. A room has to be airtight. There have to be limits to re-entry. It has to sit for a certain amount of time, and the concentration of hydrogen peroxide in the air has to be lowered to a certain amount before someone can go in there, or there could be potential harm. It's important, again, to understand that you don't want to use these because in certain scenarios, unless it's very specific, like I said, specific use conditions, because you could be introducing another hazard into the workplace. Again, ozone generators. Some people are using these to clean the air in the room, so to speak, but you don't want to, again, use those because ozone is going to be an irritant. So it's just things you need to keep in mind if you're looking at, or if you're hearing about technology to control these exposures from an administrative standpoint, or maybe even an engineering standpoint, that you have to understand if you're going to introduce a chemical or something else like a chemical or any even charged particles into the environment, you are potentially introducing a new hazard that needs to be evaluated and determine whether or not it meets the criteria of a risk that needs to be controlled. So if you have a facility that has been closed for a period of time, or if you had a reduction in staff or capacity of the facility, and you are planning on reopening the facility or have reopened the facility, you need to understand that there are evaluations that need to occur after you reoccupy it. There are environmental and indoor environmental quality changes that can be negatively impacted by the closure. Buildings and supportive systems were designed to be used while occupied. And if you change that balance of individuals versus the building without accounting for those changes, then you're going to have a potential environmental or impact on the indoor environmental quality. One is if you're thinking HVAC systems. Now, I know a lot of operations are not going to have those, and you're going to have local exhaust ventilation or dilution ventilation on the factory floor. But if you have an office space where you shut down the facility, and you didn't do anything, if you didn't maintain the temperature, if you just bumped it up or turned off the system, you could have introduced a high humidity environment in there, which could lead to mold and moisture issues. What about changes in facility water quality? Now, this is a big one. A facility is designed to have a large amount of water flowing through it, whether it's from its operations or the people that are within that facility using it. Water stagnation is going to occur if you shut down a facility, and it's going to, the longer the water sits there, the less disinfectant like chlorine is going to be in the water, which could lead to potential issues that we'll discuss next. One big issue if you're dealing with a facility that has been closed and there has been water stagnation and the disinfectant has been depleted within the water system is the potential for Legionella to grow within the facility water system. It is a real concern. It is something that is not addressed or not evaluated. It could be allowed to grow and impact the facility occupants, and it's something to keep in mind. Exposure to Legionella could lead to, within the bacteria within water, could lead to Legionnaire's disease. Legionnaire's disease is characterized by a fever, characterized by a pneumonia, and characterized by a cough. COVID-19 is also characterized by fever, pneumonia, and a cough. So you may have a facility that has an outbreak or cases that you don't know about because they are potentially being considered or looked at as COVID-19 cases. So that's something to keep in mind. What systems do you have to evaluate? You look at your potable water systems. What about your cooling towers or if you have any other cooling operations that go on within your facility. And this is just an example of how serious it is. CDC does have guidance on dealing with Legionnaire's disease and Legionella within water systems. And this story here from CNN says coronavirus shutdown caused new risk at CDC. They have several buildings that they leased. It was found within their water systems at those facilities. And it says it likely grew because of the prolonged pandemic shutdown. So even the CDC is not immune to having Legionella within their water system because of water stagnation and the depletion of disinfectant. So that's something to keep in mind. If you have not had a facility or an assessment of your facility done for Legionella, it's something to consider to make sure that you're maintaining the safety of your employees, that you are not ignoring one potential issue by focusing too much on COVID-19. And we'll discuss that a little more in a moment. So we've discussed ways to mitigate risk. We've looked at exposures. We've looked at potentials for exposures, how people can be contaminated, and why we need to do cleaning, why we need to have administrative controls in place for limiting exposure between individuals and limiting or maintaining a clean exposure with individuals and their environment. These are all techniques for risk mitigation because of SARS-CoV-2 here in this scenario, but it can apply to a number of different hazards. The one that we use here today was COVID-19 or the disease COVID-19, but these kind of techniques can be applied anywhere. It's important to remember that for this indoor work environment, when you're looking at cleaning or administrative controls of it, there is no one-size-fits-all model. Each facility needs its own assessment performed to adequately control hazards. You're going to have to determine what the hazards are, again, whether it's COVID-19 or any other potential hazard. You're going to have to evaluate the risk and determine which are the methods that are most appropriate for controlling those. What are your plans? Right now, everyone's focused on COVID-19. That's the thing that is driving a lot of what we're doing. But what are we going to do beyond COVID-19? What are we going to do 5 or 10 years from now? What if the next issue that comes up is nothing like COVID-19? So I think it's important for your facility, if you're looking at beyond, if you're going to have you need to have an emergency response plan in place that is comprehensive, that is dealing with not only COVID-19 but other potential outcomes and what to do with those. Like I said, if you had something in place, you could say, all right, well, for these scenarios, if we have a bacteria or a virus, we're going to have a cleaning protocol in place, and we're going to do that. But everyone's playing a little bit of catch up. So I think it's important for us to look at ways that we can think proactively and say, okay, what scenarios, exposure scenarios or workplace scenarios can we get in place that we are going to potentially deal with, and how can we mitigate those risks? And that's what it's all about, is making sure that your employees are safe when they come to work, that are working safely, and that they are maintaining a safe environment so they go home safely. These are some American Industrial Hygiene Association COVID-19 resources. I have been a co-author on some of these resources. There are ways for safe and effective practices for custodians. We get it down to the custodian level. We look at employers' guides, workplace cleaning in COVID-19, and recovering from COVID-19 building closures. If you want to go get these and more guidance documents, backtoworksafely.org features experts in industry specific guidance for reopening and re-engaging from COVID-19. Again, that's backtoworksafely.org. Thank you, everyone, for attending. I appreciate it. If you have any questions or any comments or need any additional guidance on anything that I discussed in the presentation, you feel free to reach out to me. My email address is on the screen, as well as my phone number, 321-263-1333, and the website, exp-assessment.com. Thank you.